Hello and welcome to lyra.com, the place where you can find the most up-to-date and best advice, as well as the tools and supplements to remain holistically healthy, as well as treat your illnesses and conditions, and all of it holistically without any side effects. That's what we specialize in. And if you don't know it already, go to our blog section, for example, on our homepage, and you will find daily news articles from all over the world about new solutions, all of them natural, all of them with no side effects, and you can stay up to date. Subscribe also to our newsletter. We always bring you the newest information that is available. And today we wanted to talk about pyrrole disorder, better known as HPU. In the US it's often called KPU and Mauve or Mauve. And why do we want to talk about this condition today? Because last week we talked about Lyme disease and how to treat it, and unfortunately 30 to 70% of Lyme disease patients have this often overseen condition that has disastrous consequences. So if you're a Lyme disease patient, you have to first check for HPU, and we're going to talk here about the disease itself, how it develops, what are the causes, what are the symptoms, and give you hands-on advice on how to treat it holistically. It's very easy. The main thing is a very good detox protocol that you have to follow. We're going to go into detail about that in this video. And also schizophrenic patients, very important for those that because 50 to 80% are affected by this debilitating condition. For them it's also very important to test for HPU. And so you have to see this presentation in context with last week's video that was about Lyme disease, and I'm going to post the link in the description box below. If you haven't watched it yet, I highly recommend it. We go in depth about this condition called Lyme disease. We give you hands-on advice on how to diagnose it, how to treat it, and we're going to do the same with HPU today, because it's crucial to diagnose HPU and treat it, and you can treat it, you will see in this presentation, successfully within a couple of months before you attack the other symptoms and the other conditions associated with Lyme disease. So without further ado, let's dive right in and learn more about pyrrole disorder or HPU. So let's kick this off by talking about porphyria. It refers to a group of disorders that result from a build-up of natural chemicals that produce porphyrin in your body, and porphyrins are essential for the functioning of the hemoglobin, which is a protein in your red blood cells that binds iron, as well as it carries oxygen to your organs and tissue. And high levels of porphyrins can cause significant problems. Porphyria mainly affects the nervous system, your skin, and the internal organs, and the signs and symptoms of porphyria can vary depending on the specific type and severity of the condition. Porphyria is also usually inherited. One or both parents pass along an abnormal gene to their child, but in some types of porphyria, environmental factors may also trigger the development of the symptoms. There are two general categories of porphyria. One is acute and the other one is chronic. The acute one mainly affects the nervous system, so your central nervous system and your autonomic nervous system, and the chronic one mainly affects your skin. Some types of porphyria show both nervous system symptoms as well as skin symptoms, and others have mainly one or the other. The heme metabolism is blocked by porphyria, and the not metabolized porphyrins are then enriching in different organs, and this causes locally different toxic effects and thus different symptoms in your nervous system, skin appearance, acute as well as in chronic forms. These symptoms can be aggravated by sunlight, noise, infections, stress, drugs, as well as chemicals. And just because you have inherited a gene or genes that can cause porphyria, it doesn't mean that you will have signs and symptoms. You might have what's called latent porphyria and never have any symptoms all of your life. What causes porphyria? Well, it's caused by 8 enzymes that are missing, and you can see this here on the left. Here are the enzymes, the 8 enzymes that are necessary for your heme synthesis. And on the left, you see the names of them, of the enzymes, the ALA synthase, the ALA dehydratase, PAG, etc., etc. And here you see the porphyrias that result from those enzymes missing in your system. So if you're missing ALA, then you get the ALA dehydratase deficiency porphyria. Then if you have the PAG missing, then you get the acute intermittent porphyria, etc., etc. And here on the right picture, you can see the whole heme synthesis process. But that's not all. HPU, the condition can also be induced by chemicals and drugs, and different ones. And first case was discovered in 1979 when HPU was caused by lead, for example. And the chemicals that might lead to the HPU conditions are aluminum and its compounds, atrazine, lead, carbaryl, chlordane, chloroform, DDT and its metabolites, dibenzofurane, dieldrine, endosulfan, ethanol, ethylene oxide, hexachlorobenzol, cadmium, landan, parathion, pentachlorophenol, PCBs, pyrethroid, mercury and its compounds, sterol 2378, tetrachlordibenzo-P-dioxine, short TCDD, trichlorphenol, as well as vinyl chloride. And drugs that might lead to this condition are amitriptyline, barbiturates, carbamazepine, diazepam, cresofulvine, halothane, imipramine, isoniazide, meprobamate, methamphetamine, estrogen, oxazepam, progesterone, sulfonamide, antibiotics, as well as tetracycline. So the KPU HPU condition was first discovered by Abraham Hofer, a medical doctor in 1958. And he noticed that in the urine of his schizophrenic patients, he was discovering a compound he named the Mauve factor, and which was later falsely identified as cryptopyrrole, KPU, and finally correctly identified as HPU and HPL as well. These complexes are bound to P5P, which is the bioactive form of vitamin B6, and this is a catalyst for at least 113 known essential enzymatic reactions in your body. The urinary porphyrins are elevated, especially the coproporphyrinogen 1 minerals such as zinc and manganese are deficient at the same time. And this condition is today referred to as HPU and belongs to the porphyrinopathy condition class. Other names that are used in literature are malvaria, pyroluria, hemocryptopyrrolactomuria, as well as the name Mauve condition. Many Lyme disease patients, it's assumed that up to 80% have this condition. Many autistic children, as well as many schizophrenic patients, have a high percentage of HPU, and this was also demonstrated using the correct HPU testing methods that we're going to talk about a little bit later. Acute HPU is mainly inherited, as we talked about already, and shows symptoms related to your nervous systems. And chronic HPU is mainly related to skin symptoms. However, other symptoms such as headaches, concentration weakness, seizures, personality disorders, excessive sweating, high blood pressure, palpitations with a high pulse, abdominal pain, nausea, vomiting, constipation, and many others are frequent as well. So Dr. Hofer said that 27 from 39 early schizophrenic patients show HPU, 10 from 14 criminal patients with divine behavior are also HPU positive. Down syndrome patients are 70% HPU positive. ADHD children are 30% positive. ETOH, so alcohol addiction patients, are 20 to 80% HPU positive. Lyme disease patients are 80% HPU positive, according to Dr. Klinghardt. Toxic patients with mercury and lead retention are 75% HPU positive. And we also suspect that more than 80% of ASD kids have HPU and should be treated for it. And here down below you see a table with all the deficient enzymes, the associated porphyria, the name of the type of porphyria, the inheritance, the symptoms, as well as the prevalence. Let's go a little bit more into details about the symptoms that you might be displaying. The symptoms caused by direct pyridoxal 5-phosphate, zinc and mangan deficiency are low muscle activity and muscle spasms, epileptoid seizures and cramping, joint problems, excessive mobility of joints, as well as pelvis instability, digestive and gastrointestinal problems, carbohydrate intolerance, deficient protein digestion, food allergies, the heart and the blood vessels instability and health problems caused by homocysteine, menstruation, pregnancy, as well as delivery problems, diabetes type 2, as well as reactive hypoglycemia, and symptoms that are caused by the disturbed heme production, mostly when the HBL is very high, are anemia, fatigue, as well as liver problems, depression, schizophrenia, and psychosis, as well as muscle weaknesses. Another important thing to know about the symptoms is symptoms caused by the hormonal disorders are dependent on HBL concentration, as well as age, stress, if you take or if you don't take the anti-baby pill, as well as excessive vegetarian diets. And the symptoms here are permanent fatigue and tiredness, headaches and migraines, allergies and gluten sensibilities, infection predispositions, low blood pressure, infertility, as well as overweight. HPU also appears in children, and symptoms of children that are affected by this condition are pale skin on the face, repeating ear infections, as well as colds, allergies, like hay allergies, skin rashes, eczemas, hyperactivity like ADD, ADHD, headaches, migraines, that you bruise easily, anemia, a low tonus for physical activity, abdominal pain, especially in the superior segment. If your skin is tanning yellowish brown, the joints are overflexing, fungal infections, as well as skin eczemas, herpes, virus outbreaks, left knee painful during the growth phase, disordered handwriting, white spots on your nails, low appetite, sunlight sensitivity, sweet mouth odor, constipation or large volume stool that is lightly colored only, learning and behavioral abnormalities, China doll look, indigo babies, thin fine hair, as well as thin nails, deformed toenails, bloated bellies. If you don't like to move, or the child doesn't like to move because of pain in his knees, hip, as well as ankles. If your child often gets hurt, difficulty sleeping, stress intolerance, frequent parasites, as well as anal itching might be all symptoms that lead to the HPU condition diagnosis. And here you can see the HPU symptoms for your skin and nails. And here you can see 3 pictures on the right that show them pretty well. Leukonychia, also known as white nails or milk spots, is a medical term for white discoloration appearing on your nails due to HPU. And cutaneous symptoms are showing blisters, erosion of skin, as well as hypopigmentation of your skin. So what do we have to look out for when we test for HPU in a laboratory? Where we look for high LDL and low HDL, a low normal alkaline phosphatase, so zinc and magnesium, as well as low WBC, which is also zinc related, low omega-6 fatty acids in your red cell membrane test, low taurine in amino acid profile, high MCV values, which is your vitamin B6, WBC and RBC, zinc and manganese levels may be normal, while the bone and CNS are severely deficient also, so careful there. Bone biopsies have been a reliable predictor of KPU. P5P is needed for absorption of zinc, manganese, magnesium and chromium, and P5P is also needed to produce niacin from tryptophan, so you should also check for the P5P levels. So how do we perform those tests? Well, there are two different tests that can be performed, and both are done on your urine that has been collected over 24 hours. One is the HPL test and the other one is the KPU test. In the US, mostly the KPU test is performed. It can give many errors, but it is significantly cheaper. And for the HPU, it is important. It's mainly done in Europe. The hydroxyhemipyrrole pyridoxal 5-phosphate zinc chelate is here very important for the HPU test, and this is what is being determined in this test. How to collect your urine for a correct HPL test and diagnosis? Well, you do a 24-hour urine test for HPU at a vitamin diagnostics lab, for example. You do not take vitamins, especially no vitamin Bs, as well as no minerals, 5 days prior to the test. You need a normal exposure to daily stress to not affect the results. Use cleaned large orange or milk juice carton for collection. And then fill it in a transport tube. Add 500 milligrams of ascorbic acid per liter of urine to stabilize the pyrroles. Wrap aluminum or aluminum foil around a collection container and transport tube to prevent light-induced pyrrole breakdown. Keep the collection container in your fridge and pour into the collection tube. Briefly freeze to break up the tetrapyrroles and then send it to the lab. If you perform the HPL test, which we recommend as it is more expensive but better when it comes to results, more accurate than the KPU test, then you will get graphs like this where it shows you the B6 activity and with the optimum amount and a curve and HPL in micrograms per deciliter in this case. You also get a result on your WBC zinc levels, as you can see in this graph from a patient from the HPL test. You will also get results on your plasma biotin from this test, as you can see in this picture. The test will also look for reduced glutathione levels in your blood plasma, as you can see from this graph. And last but not least, the test will look at your plasma nitric oxide levels that you can see in this graph down below. When it comes to diagnosing HPU, the diagnosis is not that easy, as we have seen from the myriad of symptoms that might be an expression of this condition, but we have some hints that when we might suspect HPU is present. For example, as we talked about already, almost 80% of Lyme disease patients have HPU. If you are affected by autism and other disorders on the spectrum, the risk percentage is very high. If you have Rett syndrome, Asperger and indigo children are often affected. CFIDS as well as FMS patients are often affected. Heavy metal toxicity can lead to HPU as well as schizophrenia, as we have seen. So if we have one or more than one of those conditions present, we should test for HPU definitely. And now that we've talked at length about the condition, its symptoms, how to detect them, how to diagnose, let's talk about the most important thing, how to treat it, the general therapy concept for HPU. And first and foremost, you should look at your diet. And we recommend here, and many doctors, a ketogenic diet free of sugars, starch and gluten, as also with reduced proteins, free of tomatoes and other nightshades. And you should also eat small portions over the day and not big meals. Daily walking, biking, swimming, any kind of moderate fitness is very beneficial. You don't need to do excessive sport or fitness, by the way. Just a daily movement and performance of your body is very, very beneficial here. Avoid, of course, stress. Meditate, for example. Take regular vacations if you can. And then take some supplements. We recommend that you take before breakfast zinc, 250 milligrams per day for 3 to 4 months. Zinc as picolinate, gluconate, citrate or sulfate. Later in the treatment, less zinc may be needed for maintenance only. Initially, zinc in high doses can cause nausea, and carboanhydrase is a zinc deficient enzyme. So give zinc several times per day in smaller doses, and maybe with vinegar even in your water. It's really, really good. The symptom disappears in about 2 to 4 months. Zinc also depletes copper levels, and some patients therefore become copper deficient. So you should monitor with red cell mineral tests and replace, if indicated, your copper levels as well. Manganese, 20 to 50 milligrams per day is very good. Microminerals, 1 tablespoon. Chromium, 454, 1 cap thereof before each meal, 3 times a day, as well as molybdenum. In case of the brain allergies and sulfur intolerance, we also recommend 10 milligrams of biotin. After breakfast, take arachidonic acid from omega-6 oils or ghee, evening primrose, borage oil, black currant oil, and fish oil. And in the evening time, take P5P, 50 milligrams thereof, B6, 25 milligrams, magnesium glycinate, 600 milligrams, you can go up to 1600, even calcium citrate, 1200 milligrams, niacin, 500 milligrams thereof, and taurine, 500 milligrams thereof as well before eating. For Deperol basis, you take 1 capsule per day, and you keep a control HPL, you keep checking your HPL and blood values. HPU also, unfortunately, often is accompanied by parasites, other parasites, and in HPU positive patients, you should therefore always consider bowel microbes, parasites, mold-producing different biotoxins, especially in chronic Lyme disease patients. Viruses are opportunistic and come on board when the immune defense is down, as it is the case with HPU. And here, garlic is your holy grail of any viral treatment. Supplementation probiotic from BII treats Clostridium difficile organic high allicin from freeze-dried garlic. Here we recommend the company BioPure. It releases 30 milligrams of allicin when it is dissolved, which is unmatched by any other product that we know of. Most ASD children start carving garlic when they are on the HPU treatment for a few months and stable with this treatment. Even the ones that do not, based on the genetic profile. The full adult dose is 3 caps dissolved in water 3 to 4 times per day. Another aspect of a good therapy for the HPU condition involves a supervised metal detox. plan. And metal detoxification is a must when taking such high amounts of zinc, because you dislocate heavy metals such as cadmium, mercury, nickel, etc., and those are released from the complexes they built before. Best to use are microsilica here for the metal detox, 1 to 4 doses per day at 100 milligram each. Sunwave enhanced chlorella, 15 tablespoons with the meals. Here we recommend the company BioPure. Singlet oxygen generated in water and inhalation. You can also mobilize the metals from their binding sites and provide glutathione precursors and binding peptides. Here we recommend that you take nanonized chlorella 5 to 6 sprays, for example from Matrix Metals and BioPure again. Energized cilantro, a tincture, 15 drops thereof. And to shuttle metals from intracellular environments to the liver, you can use phospholipid exchange, which is a charged EDTA, lipoic acid, phospholipids, magnesium, 1 tablespoon twice daily, and it enhances the absorption of all nutrients given at the same time. The mobilized metals must be excreted through the liver, gastrointestinal tract, as well as your kidneys, and for this you can use the Matrix electrolyte, 2 to 8 tablespoons in daily water from the company BioPure, and water with glucose, so agave, honey, and maple. And you can substitute HPU-related chronic trace mineral losses with monoatomic elements using the microminerals from BioPure. Here, 2 tablespoons in daily water. There are some issues with HPU therapy in general that you should pay attention to. You should watch out for the detox crisis 2 to 6 weeks into the treatment, and then other waves of it a month into the treatment. And do not underestimate this subject. Use the strongest available detox agents during your detox crisis, which are DMSA, 100 to 200 milligrams every 2 to 3 hours for several days. During less acute phases, 200 milligrams at bedtime every other night is sufficient. Transdermal DMPS, 3 to 6 milligram per kilogram of weight, of body weight, even daily for a few days, then once every 2 weeks. Zinc DTPA, 1 vial slow every 4 to 6 hours for 2 days or until your crisis is over. Vitamin C, here 50 to 75 grams. Colonics and lymphatic drainage, massive amounts of chlorella, zeolite, or best microsilica. And due to heavy metal toxicity, many times detox pathways are overwhelming and ineffective due also to the lack of glutathione. In Lyme disease patients, microbes also induce HPU to deplete of zinc, the white cells, and weaken thus their fighting abilities. HPU is also the underlying cause for many, if not the most, neurological illnesses. So it's common in MS patients, Parkinson, depression, and autism patients. When HPU is correctly diagnosed and the recommended substitution of supplements is included in the treatment, the outcome can be dramatically improved. Many HPU patients are also copper intolerant, but at the same time copper deficient in various body parts, like your cranial nerves, frontal lobe, dopamine, etc. And zinc may have a synergistic effect with mercury and may temporarily increase toxic symptoms as well. So zinc is a sulfhydryl affinitive metal and binds to the same metal complexing agents as mercury by competition. Supplementing zinc therefore liberates many 2-valent toxic metals such as plumb, cadmium, aluminium, etc. And these start moving and may cause damage on their way out. And therefore the patients need metal capturing agents on board like CVE, cilantro, and other antioxidants. And they need to support with other detox strategies like colonics, in chelation form, phospholipid exchange, DMSA, etc. We talked about all of this already. Zinc is part also of many metal proteinases, so these are activated in Lyme disease and cancer. Disulfiram is a very effective antidote against this. The HPU protocol improves hormonal status also, and patient may become symptomatic, like hyperthyroid function and no more need for progesterone, etc. And your kidneys also often need support with drainage remedies such as live water and matrix electrolytes. And those are some of the issues that you should pay close attention to while performing the HPU treatment. And before we sum HPU up, some therapy tips from us, additional ones. You can and you should increase your mitochondrial activity and ATP with the Geno62, the Aquatone, and the Kindling Easy devices. You can find all of those in the description box below. You should increase your brain metabolism with Q-Light and Vision Color Light. I'm going to post links to all of those devices below. Use a homeopathic detox for vaccines and chemicals. Also use an immune system modulation and deep detox with the Matrix system. Low dopamine levels in children. If you have this, then you should use L-DOPA for language and movement skills. And you should consider at bedtime 4 to 6 caps of some kind of bitter. Orange octopamine in adults and mucuna powder, and you should test urine organic acids for chemicals and toxins, or a gold profile from Great Plains Lab, for example, and with specific detox suggestions, or a 48-day detox pack from HBN is recommended here. So let's sum this all up. Porphyria, as we have learned, is also known as pyrrole disorder, Mauve factor, KPU, or more correctly, HPU. It is a porphyrinopathy due to a disturbed heme metabolism, and heme synthesis needs 8 enzymes, as we have seen, which show different abnormalities if they are missing in the HPU patients. HPU is a genetically inherited condition and can be induced also by chemicals and drugs that we have looked at. It is also associated with stress. It manifests with different symptoms, most of these being disorders in your central nervous system, autonomic nervous system, your skin, and your psychological behavior. It is very characteristic to Lyme disease patients, ADD, as well as ADHD, and autistic children, Down syndrome patients, Asperger, and Rett syndrome patients, as well as schizophrenic patients, as we have seen. To correctly diagnose HPU, it is necessary to determine the hydroxy hemopyrrole pyridoxal 5-phosphate zinc chelate, short HPL, in urine that is collected within 24 hours and prepared accordingly to our description in this presentation. Therapy is based on supplementation with zinc P5P, which is vitamin B6, biotin, taurine, niacin, manganese, and it's also associated with a targeted heavy metals detox and parasite treatment. Other important components of the HPU therapy is a strict ketogenic diet that avoids sugar, starch, excludes gluten, due to the HPU gluten sensitivity, and you should also avoid stress. And the therapy must be always coordinated, of course, with a doctor, so don't just go ahead and do what we're telling you here. This is just some advice from holistic medicine that is available today, and we still recommend that you consult every time with your practitioner, best with your holistic practitioner, not on the regular one, because they will gonna put you on regular drugs, of course. HPU therapy is also well enhanced when using bioenergetic therapy, and here we recommend the Geno62, the Aquatone and Triomed devices, the Kindling Easy, the Matrix Detox, the bioresonance devices, and Bioscan SWA that is very good for regular determination of body fluid parameters and toxins, hormones, etc. And I'm gonna post all the necessary links to these devices in the description box below. I hope that you found all of this information helpful, and until next time, stay healthy.